Tonight, a Memorial Day weekend unlike any other in recent memory is underway. More beaches are open for the first time in months, though with strict social distancing requirements. The CDC now downplaying the risk of virus transmission through surfaces, but emphasizing the threat of person-to-person contact.
The major transmission source is airborne. It takes you back to wear a mask. Wear a mask.
The White House says the metro areas with the highest rates of confirmed cases right now are Washington, D.C., Baltimore, Chicago, and Minneapolis.
There is still significant virus circulating here.
New York City continues to drop, but authorities here are urging people not to take mass transit this holiday weekend. Visitors to Coney Island are allowed to walk on the beach, but no swimming's allowed. Throughout the Northeast, many beaches are operating at half capacity. From Florida to Virginia to California, many beachgoers will enjoy their first sun-soaked days in months. But with that freedom comes caution.
We would like people to be respectful of the rules and the regulations for not only themselves, but for the entire community.
The CDC estimates 35% of people with COVID-19 don't have symptoms, and 40% of transmissions happen before people are even sick.
You are nuts wearing that mask for a 99% survival rate.
Even so, there are passionate confrontations erupting over wearing masks in public.
I have a doctor's note where I don't have to wear one. I'll show you.
With all 50 states now partially reopened, Alaska today is going even further, allowing all businesses to operate without capacity restrictions.
We want to do our part in making sure the community is completely safe and not just go gung-ho and put people at risk.
Racetracks in Indiana are reopening, so are dine-in restaurants in Kentucky at one-third capacity with disposable menus and utensils.
We're going to have people up front making sure to guide customers through the process.
3, 2.
Tonight, the countdown is also over in northern Michigan, where some bars opened at midnight and customers wasted no time.
Hopefully everyone's, the curve stays where it is. There's no guarantees, but we're taking a lot of precautions.
Nationwide, a patchwork of precautions for the unofficial start of summer. Gabe Gutierrez, NBC News, New York.
I'm Kristen Welker at the White House. In an appeal to some of his most ardent supporters, evangelicals, President Trump today demanding that governors allow places of worship to open immediately all across the country.
The governors need to do the right thing and allow these very important, essential places of faith to open right now for this weekend.
Arguing those locations are essential.
Some governors have deemed liquor stores and abortion clinics as essential, but have left out churches and other houses of worship. It's not right.
But unlike liquor stores, people typically gather in large numbers and for an extended period of time at houses of worship, increasing the risk of spreading the virus. And in a reversal of his claim that it is up to governors to reopen their states, the president now insists he has the ultimate authority.
If they don't do it, I will override the governors. In America, we need more prayer, not less.
Under the Constitution, a president cannot override a governor's police powers.
The president said he's going to override the governors. Under what authority would he do that?
Well, I think you're posing a hypothetical, and I think we can all hope that we see governors.
Said he would override the governors.
Well, I think you're posing a hypothetical.
The White House press secretary then accused reporters of wanting houses of worship to stay closed, prompting this exchange.
Really, I object to that. I mean, I go to church. I'm dying to go back to church. The question that we're asking you and would like to have asked the president and Dr. Birx is it safe?
It is safe to reopen your churches if you do so in accordance with the guidelines.
The CDC just releasing those guidelines today after they were delayed amid a battle with the White House accusing the CDC of being too restrictive. The recommendations suggest people wear cloth face coverings, enhance cleaning, social distance, and limit shared materials. Also tonight, the largest study yet of the controversial drug hydroxychloroquine, an anti-malaria drug the president has touted and taken. Despite no evidence yet, it prevents COVID-19. The sweeping study of more than 96,000 patients with COVID found there was a 34% increase in risk of death for patients who took the drug and a 130% increased risk of serious heart arrhythmia. The president has consistently tested negative for the virus and remained defiant just this week.
You know the expression I've used, John? What do you have to lose?
Kristen Welker, NBC News, the White House.
There is nowhere in the world tonight where the virus is spreading faster than Brazil. The death toll soaring and hospitals there overwhelmed. NBC's Bill Neely is there.
On Brazil's front line, the casualties are mounting horrifically. Tens of thousands of new cases every day. This intensive care unit, like most, full.
What's striking is how young people are in here.
Yeah, it's incredible because most of people is around 40 years old.
40. And some are in their 30s.
Yes, yes.
The death toll is doubling so fast they can't dig the graves quickly enough. These are the most vulnerable, living in Latin America's most densely populated area. Their poverty turbocharging Brazil's death toll.
People live here sometimes 6 or 7 to a room, so social distancing is impossible. And if they don't go out to work, they don't eat.
Tá muito difícil.
You're worried, it's difficult.
And they're scared. Most people don't wear masks, they can't get them. They've lost jobs, so they're fed by aid groups. In the center of Brazil's richest city, the newly jobless line up for food. Their president announced billions in aid, but he wants lockdowns to end and Brazil to get back to work. At a soccer stadium, a new field hospital, ready for the next wave. Brazil, say experts, still weeks away from its peak of infections. Bill Neely, NBC News, Sao Paulo.
I'm Richard Engel in Mexico City, where paramedics tell us 95% of their ambulance calls are now for suspected COVID cases. We followed one crew transferring patients in plastic capsules with air filters they made themselves. But the contagion risk is just part of the problem here. Hospitals are now so crowded, ambulances are often turned away.
The government services are overwhelmed.
Fernando Aviles has been a paramedic for 28 years.
A lot of the hospitals, they say what? Sorry, we're full.
Sorry, we're
full.
Go somewhere else. Find somewhere else. That's exactly what they're doing.
The hospitals that are willing to take patients are often the most poorly equipped, where frustrated staff have been protesting the lack of protective equipment. Officially, Mexico's COVID death toll is around 6,000, but who knows? The government's top COVID advisor openly says they're not testing much.
It is challenging to attempt to count everyone. No country can.
It sounds like you're not testing by choice, as opposed to not testing because you can't do it.
Sure, absolutely. Thank you for putting that out. That's the exact answer.
So the best way to judge the scale and toll of the pandemic here may be at the crematoriums, filled with bodies and working around the clock. Richard Engel, NBC News, Mexico City.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.